Hi, my name is Mark Parkinson. I'm the President and CEO of the American Healthcare Association and NCAL. And I'm here today to encourage you to respond to the CMS rule that sets out the requirements of participation. I'm coming to you because this is really important. You know, as Medicare and Medicaid providers, we understand that CMS has the right to set out the rules. In fact, they did it back in 1991 and haven't done it since then in a comprehensive way. So we knew that they were going to issue some new requirements of participation, and we'd actually been working with them in hopes that these new rules would modernize the regulations that we operate under. Unfortunately, that didn't happen. While there are some good things in the rule, there are also some very bad things that collectively, when they add up, just create too much of a burden on all of our providers. What we would typically do in this situation is to have AHCA NCAL respond with comments to CMS. And that's important, but we don't think it's enough. We think in order to really push back on these regulations, we need thousands of members to respond. We need not just companies to respond, we need administrators, we need directors of nursing, we need CNAs, we need CMS to understand that we can't accept this entire regulation. Now you might ask why. Well, although again there are some good things in the rule, CMS itself admits that the average cost to a facility to implement all these changes is $47,000 a year. And we think that's an understatement. On top of that, the rule contemplates getting rid of arbitration agreements, putting new burdens upon us, and when you add it all up, it's just more and more regulation and nothing good for our residents. So here's what we've done. We've set up a special web page at the AHCA NCAL website that you can access, and it will give you a lot of information explaining to you how easy it is for you to send a letter commenting on this proposed rule. On the web page, you'll find who to send it to. You'll find some sample letters, and there you'll see that this doesn't have to be a 3 or a 4 or a 10-page treatise. Just a simple page explaining your concern about the new rule would really be helpful. You know, I went to the website myself just yesterday to prepare my own response. Of course, AHCA will do it, but as an individual, I wanted to respond too. And in fact, here's the letter that I put together. In the first part of the letter, I talked about the facilities that Stacy and I still have an ownership interest in. I think it's important that you tell CMS about what you do with this work and how important the work is to you. Then secondly, I focused on what concerned me about the regulation, which was that there are just too many regulations being thrown upon on top of a lot of other changes that are occurring. You add in the cost, and I just told them it was too much. And finally, I ended by telling them what the impact would be on beneficiaries, on our residents, that all the time that we spend trying to work out these new regulations and spending money on these just really takes away from the great work that we're doing in our buildings. We're trying to make this as user-friendly as possible and really encourage you to put together a letter of comments. Now, we want to recognize you if you do that. At convention, we're going to have a special ribbon. You know those ribbons that talk about past chairmen or PAC donors or people that are speakers? There's going to be a special ribbon for folks that send in comments to CMS. The comments are due on September 14th. We'll all get together at convention in San Antonio in October, and those of you that have joined us will have a ribbon that says CMS heard me. You know, what we've learned over the past many years is that individually, it's really hard for us to have much of an impact in DC, whether it's on the Hill or at CMS. But when you put together the combined numbers of our membership, we can make a real difference. Comments from AHCA matter, but what really matters is getting thousands of our members to put together comments that just tell CMS, hey, we want to provide great care, we want to do the right things for our residents, but overregulation, expensive rules aren't the way to go. Thank you very much, and I look forward to seeing you at convention in San Antonio.